Hi, my name is Megan Miller, and I'm one of the co-owners of Navigation Behavioral Consulting. I'm making my first video blog to update everyone regarding the TRICARE changes to the ABA program. We've been posting a lot of information on Facebook, and it was recently requested that we make a video about it. So what I'd like to do today is give a little bit of background information about what's happening right now with TRICARE and why we should still be concerned about the changes that are happening. First, for a little bit of disclaimer, I am only a service provider and I'm basing this information off of information gathered on TRICARE's website and press releases from TRICARE. I will include all links that I discuss in the description for this video in order of them happening. So anything that we first learned about starting in June, I'll include those links first and then up to what we currently see on the TRICARE websites. Additionally, if any of those links stop working, I have taken screenshots of most of them. So if you click on a link and it doesn't work, please feel free to contact me and I will send you the PDF file of that link. So the first thing I want to talk about is just a little bit of background information regarding TRICARE's Applied Behavior Analysis program. In about 2005, TRICARE started covering behavior analytics services for families of children with autism, and they only allowed BCBAs to provide this service. This greatly limited access to care for military families because there are not that many board-certified behavior analysts in this country or any other countries for that matter. In 2008, TRICARE started the demonstration project. They worked closely with Gina Green from the Association for Professional Behavior Analysts, Autism Speaks, and other experts in the field to develop the program and the requirements for the program. The program has been working very well for the last 4 years, starting in, 2012 is when these changes happened. So we'll say it worked really well for 4 years. It was renewed even after its expiration date because it was working so well. There were minor changes made here and there, but for the most part, it was working well. I think as a service provider, some of us would argue that better documentation and tracking of the services should have been required, but the changes that TRICARE has proposed do not meet what I'm talking about. In June, July of 2012, there was two things that happened. There was a court case where retired families sued TRICARE for not allowing them to access applied behavior analysis services. The court ruled that TRICARE needed to have a policy for retirees, and they also indicated that it wasn't clear why some families were allowed to receive the services and some were not, and that ABA is a medical treatment, not an educational treatment. It is important to note that the judge for that case did change his decision a little bit a few months ago, but he's still requiring TRICARE to implement a policy for retirees. Around that same time, a law was passed that made it required that TRICARE cover retirees as well, and that they develop a pilot program for retirees to provide services for them. At the same time, when all of this happened in the fall of 2012, we experienced a lot of issues as providers and families. TRICARE published some new policy manuals and had updates to their policy manuals, but they did not clearly explain these changes. I don't think a single provider received any correspondence from TRICARE. Families received very little correspondence from TRICARE. The only correspondence I know of families receiving is if they had a child who didn't have an autism spectrum disorder, because that was another one of the big changes that was made at this time. Families with children with intellectual disabilities, developmental disabilities, and other disabilities that are greatly improved with the use of behavior analysis were denied services because they did not have an autism diagnosis. So families who were under that umbrella received an email from TRICARE stating that they could no longer receive services. We also experienced some other issues. The regional contractors all interpreted the policies from TRICARE differently. So in the North region, BC ABAs, Board Certified Assistant Behavior Analysts, who have the same amount of understanding basically as a behavior analyst, they're given the same duties by our certifying board, the Behavior Analyst Certification Board. The only difference is that they have a bachelor's degree instead of a master's degree, and they may have taken less courses and have less field work. In our field, it's more about your qualifications and your experience along with your certification that matter. So there's a lot of BC ABAs who can provide the same exact services as a BCBA, but they should still receive supervision from a BCBA once a month and 2 times a year in person as designated by the Behavior Analyst Certification Board. However, TRICARE doesn't understand this and posted that in the North region, BC ABAs were no longer allowed to provide one-on-one services and were only allowed to supervise. In the South region, in the fall of 2012, they still allowed BC ABAs to supervise and provide one-on-one, and they still allowed families to receive this service under the ECHO program. Whereas in the North region, this service was no longer available. So one minor change from TRICARE, and you can see the lack of communication and the interpretation from the providers in the different areas for the regional contractors was completely different. One of the other issues that we experienced as providers in the fall of 2012 is all of us did not receive payments for 3 months in the North region because PGBA, the billing contractor for TRICARE, was confused about what was going on. So we all went 3 months without pay. And then again, this winter, the same thing happened because of the billing code confusion. So we all went without pay again. Many of us that provide these services are small businesses, and we will not be able to continue to provide services if these delays keep happening, and families cannot continue to keep having their services halted by providers when they're not getting paid by TRICARE. One missed day of service for these children is crucial, and any delay that TRICARE or their contractors put on these access to services is not acceptable. Now, this is where the big issue comes in. I realize I've already been talking for 6 minutes, and I'm sorry for making this so long, but it's really important to get a thorough summary of what's happening right now. So in June 2013, specifically around June 25th of 2013, Autism Speaks posted an article on their website about TRICARE turning the clock back on military families. On that article, they also posted down at the bottom the new policy manuals published by TRICARE on June 25th, 2013. I'm not sure if those manuals are available on TRICARE's website because I haven't been there to check it out, but you can still see the manuals on Autism Speaks' website. The very important thing to note about this is the manual for the basic program included pages upon pages upon pages of new requirements for providers that were set to go into effect on July 25th, 2013. I'm not going to go over what all of those requirements are because TRICARE has since stopped and said that they're not going to make those changes, but the point is they still had it out there that they were making these changes, and the changes were drastic. So what happened is the providers and the families in various regions got together via social media and contacted TRICARE, contacted the media, and we fought this. And we're very happy to announce that TRICARE posted on July 17th, 2013, that there will be no changes for active duty military families. Unfortunately, we're also very disappointed because this is not true. It's just simply not true. When you look at TRICARE's documentation that they have on their website right now, there are still changes that are going into effect. The first change is that, well, before I even start on that, let me back up a little bit. The fact that TRICARE is trying to play this off to the media, that we were making this stuff up and that these changes were never going to happen, is very disconcerting. I am a military wife and a TRICARE beneficiary, and it is very, very disconcerting to think that the insurance company who is supposed to be providing for my health care, who my husband has given his service to our country to receive this insurance, is lying to the public. If they're willing to lie about this, what else are they lying about, and how can I trust that they're providing me with the proper health care? I can't. So besides the fact that there's military families with children with autism that are being affected, all families that receive services from TRICARE should be very untrusting of them right now because the way that they're handling this issue is not appropriate, and they're not providing the proper information to families and beneficiaries and providers. So the first thing is they said that there's no changes for active duty on July 17th, 2013. They also, in their press releases, made it sound like we were making this information up when you can clearly see that these changes were set to happen, but we pressured them and they backed off. Now, these are our 3 concerns that we still have with TRICARE, and we're waiting for them to be addressed. I have sent multiple emails to TRICARE employees through contacts that I've received, and I've also posted on websites. I've sent grievances and still have yet to hear anything about this. We've also had people contacting the regional contractors, and they're getting mixed information. Some contractors say they don't even know what's happening. Some contractors say one thing, and another contractor says another thing. So clearly, TRICARE is not providing information to people in a timely manner. That's our biggest concern right now, is that there's a lack of communication from TRICARE, both as providers and for me, both as a provider and a beneficiary. I am really concerned about this because when there is a policy in place from your insurance company, you should be able to contact them and ask them questions about the policy and get answers. It shouldn't be a runaround, and they shouldn't be lying to you about what's happening. Maybe they're not lying and they really just don't know the answers, but that's, I don't know, maybe even worse. They should know the answers to the questions that we're asking. And if they don't know the answers, then they never should have put these policies out there to begin with. If you can't back up the information, then don't make a policy about it. Pretty simple. So the first concern we have is that TRICARE needs to be communicating. They need to be responding to the beneficiaries, especially because this is their plan and they should be able to get answers about the policy. We're still not clear on several things. One, we're not clear on the role of board certified assistant behavior analyst. On TRICARE's website, when you look at the demonstration project information and you look at the pilot program project information, which is for non-active duty retirees, there's still information on there that says board certified assistant behavior analyst can only provide services under the supervision of a BCBA, and it makes it sound like they're providing the reinforcement services, which is one-on-one. This will greatly limit the access to services for not only retirees but also active duty. There are 23,000 BCABAs in this country, and there's less than probably 15,000 BCBAs. I haven't checked this statistic recently, but I know just a little while ago we reached 10,000, and so with each testing cycle, I can't imagine it's gotten much higher than that. So when you think about 23,000 people who used to be, prior to 2012, fall of 2012, allowed to supervise and provide one-on-one services, are now only limited to providing one-on-one services, that will affect a lot of families. Additionally, it affects the BCABAs because you're limiting their scope of practice and what they're allowed to do. So, not only will active duty families be affected by this, obviously retirees will be affected by this as well. So when TRICARE says there's no changes for active duty, they're lying. There is a huge change, and it will have a huge impact for our families. Secondly, we're also concerned about the assessments. The information on TRICARE's website right now still says that for the pilot program, that assessments need to be conducted, and it specifically outlines the assessments. We have no problem with conducting assessments. That's what our field is based off of. We collect data, probably too much data. People don't even like how much data we collect. We analyze it. We assess progress using that data. We assess progress using specific curriculums and specific assessment measures, none of which are listed under TRICARE's current plan. It just says kind of a broad statement about it, but yet they're still requiring behavior analysts to use the Vineland with no data to support it. Their data that they do reference is in their policy and press releases. They say that the Behavior Analyst Certification Board is who recommends the use of the Vineland. There was a letter sent by the Behavior Analyst Certification Board yesterday to TRICARE that you can find online as well, that says that it's not the case, that it's the exact opposite. They do not recommend a specific assessment. They do not endorse a specific assessment. And in fact, they require individualized assessment for children as the best practice. So TRICARE trying to require us to use the Vineland for an assessment is completely out of our best practice guidelines and does not work for best practice for us. And it's also not clear with the assessments. At the beginning, it says that the assessments must include a diagnosis of autism using the ADOS-2, but it's not clear who is supposed to do the diagnosis, because the way that they have it worded right now, they have the assessment process as being done by the ABA providers, and they have that ADOS diagnosis included in the assessment process. BCBAs are not certified generally or qualified to perform the ADOS in general, and especially not allowed to do it to diagnose clients. So they need to make it more clear. It's fine if the ADOS needs to be used, generally speaking, but it should be done by the doctor, and it should be part of the initial referral for an assessment, not part of the assessment process. So those are our main concerns with TRICARE's current policies. We encourage everyone to ask TRICARE, do you care, TRICARE? Do you? Because you're not acting like it. And to call them out on their press releases and the information that they're presenting to us right now. The most recent article posted by TRICARE on the defense website says that they're in it for the kids. If you're in it for the kids, you would be communicating with us about these policy changes. You would allow BC ABAs to do what they're qualified to do, which is supervise and provide one-on-one treatment. You would be ensuring appropriate access to care for both active duty and retiree families and not have a difference in requirements for them. And you would not require that retirees go through a longer process to access services. With the assessment requirement that's currently in the pilot program, there will be huge delays in services for retirees who have already been fighting for years to receive this service. We know of many retiree families who, since the law changed or since the policy changed last year, were not able to access services because it was only with a BCBA that they could receive services. Now that they can finally receive it with tutors, you're saying that they have to go through this assessment process. It takes weeks to get approval for the assessment. It'll then get weeks to get approval for services. Again, 1 day of a delay in service for our families is not acceptable, let alone weeks and weeks of delays. So please, TRICARE, show us that you care, provide us with the information that we're requesting, and fix these issues. Thank you. Oh, we will also be having a demonstration if you see this video before Sunday, July 21st. We are getting together in various locations throughout the United States. The link to that is on the bottom of this description. You can find out more information about this demonstration. We're just getting together to take pictures and show people that how many people are affected by the changes that TRICARE is trying to make. We're not protesting and getting loud and annoying or anything like that. We just want to show TRICARE the people whose lives they're affecting right now with these changes. If you also would like more information about this issue, we have a website that we started called doyoucaretricare.com, and the link to that's in the description as well.